mortality rate for those particular children? I know the cohort is quite small, but 20% is a significant jump in a 10-year period in relation to the mortality rate. Thank you.
Turnout.
Just to thank you very much. It was very interesting. I just was reading this report that we were given Too Little Too Late, and I noticed that it said that we currently have no national neonatal health policy, and that's still the case. Like, this report was 2010, and it talks, which I know you've mentioned, but it talks about the very fragmented implementation and the significant disparities across the country. And I thought maybe we could elaborate a little bit on that, because I think there is this geographical lottery, which brings us to the issue of the transport service, which I would certainly agree with the Chair that I would be supportive. I'm trying to understand the exact blocks, so maybe you could just elaborate a little bit more. I see here that it's available 9 to 5, 7 days a week. Of course, logic says why, babies don't work, that delivery from 9 to 5 and that they're on this schedule. And you mentioned about having funding, and you mentioned about the moratorium. So I'm just trying to probe exactly where the issues are, where the obstacles are to getting a 24-hour service. And then you mentioned about and Deputy Naughton mentioned about, the families and going to and from, but the other supports for families. I would be a little bit concerned to maybe to understand a little bit more. Particularly, one of the issues I've been working on is pre- and postnatal depression, which my understanding is generally anyway that 10 to 20% of women actually suffer with pre- and postnatal depression, and yet they're being told 9 months before you can get the appropriate services, which actually is a very critical time for bonding with a child, that early period. So my questions will be on those issues.
Just very briefly, first of all, thank you for your presentation, and also I suppose thank you and your colleagues for the tremendous amount of work that has been done over the last few years, because I suppose when you think of the birth rate has gone from something like 54,000 a year up to 75,000 a year without a huge increase in staff levels. And